Hi. This is skill 17.13, managing a client in restraints. Now, I showed you a video of using a belt restraint on a client, okay? I just want to show you what a wrist restraint will look like, okay? It's going to look much like the belt, but smaller, okay? And it's going to be used on the wrist. Hello, right? Okay. So this one is one type. See how it's got sheepskin in there to put against the patient's skin to keep it soft, keep from having any skin issues, okay? And what you're going to do is you're going to wrap it around the client's wrist, okay, like this, all right? And then what happens is there's this hole on this side, and you're going to feed the restraint strap through that hole. Okay, like this. Can you see that? You're going to feed it through that hole. Okay, you're going to bring it around until you get the Velcro through. There's Velcro there. You're going to bring that and you're going to attach the Velcro to the Velcro on the wrist restraint. Okay, so now you've got it like this. Okay, see that? And the restraint. Now you've got this one other cord here that's on the other side of the wrist restraint. And what you're going to do is you're going to take that and you're going to push that through the belt loop, okay? So now you're going to have both straps right beside each other, okay? Do you see this? You see the two straps, okay? They're right beside each other, okay? And then you're going to take these two straps right here and tie it to the bed or to the chair that they're sitting in. 9 times out of 10 it's in a bed. Okay, all right, so for managing clients and restraints, skill 17.13, again, before you place a patient on restraints, you have got to make sure that you have attempted everything that you can do to keep them out of restraints. Okay, we don't want to put patients in restraints. Studies have shown that patients become more volatile, they become more agitated when restraints are used. Think about it. Think about it. How would you feel if I just took you right now and strapped you to a bed and you weren't allowed to move? I'm going to think probably not so good, right? Well, that's how they feel laying in the bed. So we don't want to use restraints if we can help it, okay? So attempt all other methods of protecting the client or using less restrictive measures before applying restraints, okay? Then we're going to check our physician's order, and we're going to make sure that we have an order for it. You cannot put restraints on a patient without a physician's order, okay? Let me back up a little here. There. If it's an emergency situation, again, you can place the restraints on the client and then immediately go and notify the physician that you have put restraints on them, okay? They need to come and assess the patient within 1 hour of the restraints going on. That is a law, okay? It has to be done. Okay, so gather your equipment and supplies. What equipments do you need? You need restraints, whatever type of restraints it is that your policy has and that you need for that situation. You're going to perform wipes and you're going to explain to the patient. You're really going to explain to them what you're going to do. Okay, don't just do it. Explain to them. You're going to seek out the cooperation with the client of putting the restraints on. Because don't you want to put it on somebody that's not fighting you? Yeah, exactly. You're going to apply the restraints according to the manufacturer's directions. Every facility has something different, has some sort of different supplier for their restraints. You're just going to have to get used to what your facility is using. Ask for an in-service on the equipment, okay? You're going to monitor and assess the client every 15 minutes or according to facility policy. Okay? Every 2 hours, every 2 hours, you have to go in and you have to release the restraint. Now, if they are volatile and you have both arms in, you could go in every hour, release the left, the next hour release the right, the next hour release the left, the next hour release the right. Okay? So that every extremity is out every 2 hours. Okay, but not both of them at the same time. That's for people that are really volatile, that are really, going to harm you or harm themselves. Okay? All right. Every 2 hours, you're also going to provide toileting, fluid in foods. Okay? They might be hungry, they might be thirsty, they might need to go to the bathroom, right? You're going to do hygiene care, such as brushing teeth or washing their face and hands. Make them feel better. You're going to check for circulation and skin care. So you're going to make sure that the restraint's not too tight, that the restraint's not causing damage underneath the restraint, that the patient's not fighting it so much that now they have a bruise or a laceration or, God forbid, a skin tear underneath there. Okay? When they're fighting against the restraint, sometimes the restraint can really get tight. So you want to make sure that they're not cutting off the circulation. You're going to check for body alignment. Make sure that they're aligned properly, because it's going to be uncomfortable if they're not. You're going to provide range of motion on all joints, particularly those in the restraint. Okay, that's important. You're going to move all the joints, okay? All right. You're going to avoid application of force on long bone joints and padded bony prominences when applying or repositioning a restraint. Use those padded things. If you don't have it, what can you put in between a restraint and the patient? A washcloth. That works. You're going to take vital signs every 8 hours, or if it's indicated more frequently. Again, that's going to be policy of your facility, so make sure you know that. You're going to bathe the client every 24 hours. Well, duh, that's what we do, right? That's what we do as nurses. You're not going to interrupt the client's sleep unless indicated by his or her medical condition. So if they're sleeping, leave them alone, okay? Because maybe when they come out of that sleep, they'll be more receptive to teaching, so that you can take the restraints off. You're going to ensure that you have a new order, renewing the restraint order every 24 hours. Okay? It has to be done every 24 hours. You cannot just put a patient in restraint on Friday and leave him there until Sunday. Okay? The physician has to see him once the restraint goes on, and then the physician has to see the patient every 24 hours after the application. They have to renew the order for the restraint. The restraint is only good for 24 hours, okay? You're going to obtain a physician's order and discontinue restraints as soon as it is clinically indicated. If the patient wakes up, or the patient all of a sudden, is being compliant and not going to hurt themselves, and they've calmed down, you want to take those restraints off, okay? At any time after you've put the restraint on, or any time after you've done cares or repositioning or reapplication of restraints, you move the bed up. When you're doing that, you're going to make sure you put the bed back down, okay? You're going to make sure that the patient has some way of calling you. Make sure that call bell is within reach, okay? You're going to perform hand hygiene, and then you're going to document all your assessments. Now remember, when a patient's in restraints, it's a lot of documenting. So you're going to be doing a lot of writing or a lot of charting, okay? Again, it's according to facility policy of how often you chart, but typically when somebody is in restraints, it's every 15 minutes for vital signs, for skin checks, and then every 2 hours for each limb that is in a restraint. Okay? All right, so that's skill 1713, managing clients in restraints.